Welcome to This Week Health Conference. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, a set of channels and events dedicated to leveraging the power of community to propel healthcare forward. Today, we have an interview in action from the fall conferences on the West Coast. Here we go.
Here we are at the CHIME Fall Forum with another interview in action. My name is Sue Schade. I'm a principal with StarBridge Advisors and one of the moderators for the Town Hall podcast show. And with me today is Theresa Meadows, who is the SVP and CIO at Cook Children's Healthcare System in Fort Worth, Texas. Welcome.
Thank
Good
you.
to have you
I'm
here.
happy to be here. This is fun.
All right, this is fun, yeah. So, first off, you were in the keynote?
I was.
You were, because you did a award.
Yes, I handed the baton to the new person.
Yeah, absolutely.
Yeah.
That was great.
Yeah.
What'd you think of the keynote?
I love the keynote. I teach in boot camp the value of relationships and building your team and compassion. And so to hear it actually with evidence-based,
Yes.
I'm a nurse by background,
Yes.
so evidence-based compassion is really important, and having data to actually show it works,
Right.
which I think most people think, oh, it's just something you just have to do, but it actually works. So I loved it. I
It was
loved
great.
the keynote.
Very inspiring.
Yeah.
I want to find Dustin Huffer. Do you know Dustin?
I don't.
He's the CIO for Cooper.
Okay.
And just tell him how fortunate he is to
Yeah,
have
100%.
Anthony Mazzarelli
Yes.
as a CEO. That was great.
100%.
So what is top of mind for you these days?
Yeah, lots of things. I mean, I think, of course, the AI topic is, I'm sure, on everybody's list of
Right.
things, and mostly just how to get in front.
In front of it?
Yes.
Okay.
And
How are you doing that?
We're a little bit behind.
Okay.
So we recently just are standing up some governance processes, and our goal is really to try to do safe artificial intelligence.
Okay.
So we will start internally with really working with some of our trusted partners who have built AI into their products
Okay.
and kind of learning. And then we're going to set up a learning environment of our own so we
Great.
can use some of our own data to kind of see how this is going to work. And then we'll maybe get more brave later as we learn more. But we're still in the learning mode, which I think most people are.
Absolutely. So do you know Jeff Gottney?
I don't.
He's the CIO at Rush.
Okay.
And I interviewed him for one of the Town Hall
Okay.
podcast series. I think what he had to say about AI, I can connect you with
Oh,
him
I'd
if
love
you don't
that.
know
Yeah.
him. But on that podcast, what he said about AI and governance and kind of the four pillars, which I can't remember right
Yeah.
now, and how they've integrated it with existing processes and governance, amazing. I think they're ahead of the
That would be
game.
great.
Yeah.
That would be
I'll
great.
connect you.
That would be wonderful.
Okay.
This is worth it now.
Okay. So what are you looking forward to here at the
Lots of
forum?
things. You know, of course, always getting to see our friends and our
Right.
colleagues. That's always number one.
Yep.
I actually love the focus groups, because I think it's a time for us to help each other
Yep.
and learn from each other. And then, of course, keynotes. The keynotes are like so inspirational. I always leave super motivated about the things I want to do after listening to the keynotes. So I think those are some of the things.
Absolutely.
Yeah.
Good. So what are you looking ahead to besides maybe getting ahead of AI in
Yeah.
2024?
Yeah,
with your
we're in just a really high growth mode, so we're acquiring a lot of practices. So really having best practice around how do we do those acquisitions and how do we bring people into Cook Children's and kind of show them our new culture. We're doing a lot of work there. We're also doing a lot of work around patient experience and our mobile experience and really trying to bridge the inpatient and outpatient experience into the home. So I'm excited about some of those initiatives we have.
Great, great. I may have told you this before. I have a daughter who's a nurse practitioner.
Yes.
She's now the director of advanced practice providers for Mass General Brigham.
Oh, that's
In
exciting.
hospital at home.
Okay, that's
So I love
exciting.
talking to her about what
Yeah.
they're doing, what the issues are,
That's really
and
cool.
yeah, how it's growing.
Yeah, we're doing a little bit of that, but more on the remote monitoring. It's not quite hospital at home. We have a fairly large home health branch who does some hospital at home monitoring, home infusion, that kind of stuff. But really getting more of the technology built into that is what we're looking at, going forward.
So thinking, because you're a children's hospital, are
Yeah.
parents receptive and excited about that opportunity
They are.
in terms of
They
hospital
are.
at home?
Yeah, we have palliative care, so we have a lot of really sick kids who, for them to come for their doctor's visits even, requires an ambulance trip because they have oxygen or ventilator dependency. And so us being able to do some of that remote monitoring and then telehealth visits so that they don't have to come in and go through that trauma of coming in. So those are things parents are super excited about because it does cause a lot of trauma.
Right. And not have to find the babysitter
Correct.
for the other kids that are
Yes,
at home,
or
right?
whatever. Yeah.
Yeah, I got it. Okay. So anything exciting in terms of innovations in 23 you want to tell us about?
You know, we're looking into a couple AI initiatives around ambient listening, around using technology that actually uses video, sound, and RFID to really do some process improvement and improve caregiving, as well as maybe some auto documentation based on process. So we've got some of those happening starting in January. So that's pretty exciting.
Very exciting. Okay,
Yeah.
you got a lot going on.
A lot.
All right.
Always had a lot.
Always had a lot. Okay. Well, thank you for stopping
thank
by.
you.
This has been great, and I will get you those connections.
Awesome. Thanks
Okay.
so much.
Good.
Another great interview. I want to thank everybody who spent time with us at the conference. I love hearing from people on the front lines. It is phenomenal that you shared your wisdom and experience with the community, and we greatly appreciate it. We also want to thank our channel sponsors who are investing in our mission to develop the next generation of health leaders. They are CDW, Rubrik, Sectra, and Trellix. Thanks for listening. That's all for now.